Welcome to the Healers Café, conversations on health and healing with Manon Bolliger, a retired and deregistered naturopathic physician with 30 plus years of experience. Here you will discover engaging and informative conversations between experienced healers, covering all aspects of healing, the personal journey, the journey of the practitioner, and the amazing possibilities for our own body and spirit.
So welcome to the Healers Café, and I'm here today with Dr. Marcus Coplin, and he's a naturopathic physician specializing in the field of integrative physical and rehabilitation medicine and integrative oncology. And you're a medical director for the Springs Resort in Pagosa Springs. CEO is, what is the?
That's Colorado.
Yeah. Colorado, that's right. Okay.
For those of us south of the border.
I probably should know that, but oh well. And Murrieta Hot Spring Resorts in Murrieta, California, where he advises on science-based usage of thermal mineral hot spring water for health. You also write extensively on reemergence of the health resort culture and programming in the 21st century healthcare. So that is a super exciting topic because I do think, the idea of going to resorts is a big attraction, but a resort where you actually focus on your well-being, your health, all of that. I think that you're spot on to the absolute need. So why don't you start maybe tell us a little bit, first of all, how did you get into this whole field of naturopathy, but the understanding that the body can actually do miraculous healing and that we got all it takes.
Yeah, well, I mean, there's a lot of directions there. I think we, I'll start with the beginning, which is I got into medicine through philosophy. I was a student of philosophy, and in doing that work, I was kind of really investigating and interested in the concepts around how individuals play a part in their community narratives and how we kind of create these community identities, and how individuals kind of contribute to that, and how the community informs the individual's identity, and how the individual informs the community identity. And I was fascinated with this question. And in the midst of this, I had a friend who was visiting me, and he happened to have this little health pamphlet, like 70s style health food store pamphlet on iris diagnostics. The German system of iris diagnosis that was popularized in the United States by Bernard Jensen. He was a chiropractor in the 70s. And so I started reading this book, and I thought, oh, this is kind of weird and cool and interesting. I had never even considered this before. But the idea that the eye focuses, the eye is a neurological microcosm for the tissue system of the body was, I just couldn't put that down. And so I was still in university at the time, and I started investigating different avenues. What is this alternative medicine? That was what I was looking at the time. It led me to a few survey courses, a few, apprenticeships with different acupuncturists and chiros and Ayurvedic healers. I was just kind of just trying to get as much information because I was fascinated by it. And eventually that led me to the door of Bastyr University in Seattle, Washington, where I did my naturopathic medical education in the early 2000s. And to your other question about how did I get into how did my interests in kind of health resort culture emerge? That all happened during my time in medical school. Because so I went there kind of, I was still quite young. I was in my early 20s when I started medical school, and I had this very idealistic view of I'm going to go, this is going to be, medicine that comes from my garden. I kind of had this beautiful vision of I think, the Lord of the Rings had just come out, I was like, I had this vision of the Shire and, herbal medicines and just a very kind of bucolic life, pastoral life. At any rate, while I was in school, I learned that the tradition of naturopathy really comes from the German water cure system, and that there were these health resorts. I mean, they were called sanitariums, they were called nature cure centers, but they were these places where people would go and spend a period of time, like a health vacation, in which they would undergo a series of treatments. They would be put on a specific dietary regimen, sometimes herbal medicines, sometimes manual therapies. Always rest and exposure to the natural environment were components. And I just became obsessed with this idea. And I started saying, well, where are these places in the United States? Where are they? And save for a few kind of little vestiges of that practice, there really wasn't much in North America in general. But I found that in Europe, that concept had never really gone away. Like, what happened in the United States is we had this very robust culture of this, and it kind of died out in the early 20th century, as with most kind of, we were talking a little bit before we started recording about the Flexner report and kind of the consolidation of the medical model under one paradigm. Well, before that, these kind of what weren't called health resorts at the time, some were actually, but this concept of these places where you can go and spend a focused time to heal, they were relatively common, or at least and popular. Now, again, so in Europe, that tradition is still active, and has modernized in these interesting ways. And so I took it upon myself when I graduated. I did a postdoctoral research sabbatical throughout Europe and went to these different hospitals and just learned as much as I could from these different physicians who were running the shows there. And it was an amazing
That must have been
experience.
fascinating. So also like mud baths and wraps and hydrotherapy obviously is in big use.
Totally. And that was kind of an interesting thing that I didn't really understand the nuance of it until I was on the ground there. But yeah, there's hydrotherapy, which really is kind of any therapeutic application of water, hot water, cold water, wraps, immersions, anything that has to do with water in any of its forms, ice, steam, whatever, can be classified under hydrotherapy. Then there is this kind of subcategory or adjacent category called balneology. Balneology, baño, some people, if you speak Spanish, you might recognize that term, but balneo is the Latin for bathing. And specifically, this is the study of bathing and the use of therapeutic mineral spring water. And that was what I was seeing a lot of in Europe, is these hospitals that were actually built on mineral springs, hot springs or cold springs even, where the mineral waters were being used either as baths or as steam or lavages for the nasal cavity, or muds. Muds were often, what they'll do is they'll take the thermal mineral water and they'll take their local mud and they'll mature them together for up to a year, and that creates this medicinal substance they call a peloid. And the peloid is, it holds heat and minerality, and it has all these kind of amazing researched analgesic, anti-pain, and anti-inflammatory effects. And it's an incredible system that's very well very well administered, very well understood. It's categorized. It blew my mind. I had no idea that existed, So,
I went to one in Switzerland. My family's my dad's Swiss, my mom's from Belgium.
oh wow.
We went to these mineral baths, and it's it's definitely a different culture. But where did you find most of the active I thought it was more like in Eastern Europe, that it's much more alive and well, maybe also in Austria, or where were you able to find?
Right. Yeah. Well, there are actually hot spring, resorts or places where you can go and utilize the water therapeutically all over Europe. I've been to them in France and Germany and England and Spain, and then all the way. I don't know of a country in Europe that doesn't have a
Right.
sink, but to your point, the Eastern European cultures and the cultures that had a heavier influence with the Soviet Union, they tend to have more robust offerings
Right.
when it comes to this. And the Soviet Union, in its heyday, whatever the heyday, I don't know what to say, but sometime between the 40s and the 70s, they invested very heavily in developing these health resorts and creating these hospitals, this very well administered and well-researched hospital system, because they didn't have access to the modernity of Western medicine. So they developed their own tools, and the state kind of put investment in their population. They said, you can go to these resorts as part of your healthcare. And a lot of kind of former Soviet states, and not only, but a lot of the states that have kind of like socialist kind of government policies, they still allow for up to 2 to 3 weeks, depending on the country, of hot spring care as part of your medical care. Meaning, you go to the doctor, you have a particular diagnosis, that doctor thinks it would be good for you to go stay at a spa. They write your prescription, you go to that spa, you meet the doctor there, and you take that course of therapy, and your insurance pays for it.
Yeah.
When,
I'm waiting for the day.
well, we've got a little ways to go, but I don't think that it's that far off. I think it's going to take one company, one insurance holder that really can be a little bit more forward thinking and realize that if they can actually rehabilitate their clientele and keep them healthy, their bottom line is going to be lower. And that's the key thing that
I think you're right. It's the insurance company, right? It's in their benefit to get this, right? Like, but there is kind of a discordance, right, in our Western system between you make more money keeping people sick.
Well, I mean, certainly I mean, that's if the business model is to, maintain a certain level of pharmacological suppression of a symptom over time, if you can reverse that pathological state where people no longer need that medication, then yeah, you could make that argument that there's a financial reason. It's hard for me to believe in a world where that really is the reason why people do things. I think that ends up being kind of like more like, we don't have our mind focused on, what our purpose is. Things can kind of just go askew. And I think just more that business models have kind of entrenched themselves in this kind of automatic behavior, and no one's just stopped to say, hey, wait a second, like,
where is this leading if we do this?
Right, because you can make money selling pharmaceuticals, and the insurance company and the pharmaceutical companies have a very clear kind of business model for how that works. So to change that business model, you'd have to be a very innovative and forward thinking and have a little bit of a risk aversion. You know what I mean? Have low risk aversion. Not be worried about the risk as much. And just that you don't see big businesses dealing with multiple millions of dollars do that very often.
No. But insurance companies do have I know when I was, I don't know if you know Bowen Therapy. I run Bowen College in Canada.
Oh, fantastic. Yeah.
And in Ontario, because of the many car accidents that I ended up dealing with, they said, okay, we need to know what this therapy is, because we don't need, you don't need that many visits. All our people are getting actually better, whereas doing some of the more traditional ones, it's like takes 2 years and it costs them a lot more. So they were like, okay, how do we get this insured? And then it became political and it didn't all happen. But there was sincere interest in, financial interest, because it cost them less because people got better, So
Yeah.
that's also, it's hard to know, but I think the main thing is people. is getting people to realize that this feels good, and
Yeah, and I think that really is the key, right? Because again, I mean, even if we just, I mean, I think you and I got into medicine because we have a deep kind of resonance with that process, and you see the sacredness in the healing process, and there's something very beautiful and poetic, and for me very philosophically satisfying about medicine, especially natural medicine and systems thinking and all this. However, I mean, I think there is a reality to the world, and certainly to medicine is not outside of this reality of business economics and how they function. And it's like, but I think to your point, there is a growing market demand for therapies that have different outcomes than I'm going to be on painkillers for the next 20 years to deal with this pain.
Yep.
The idea of actually rehabilitating a pathological state, whether it's functional, whether it's immunological, what have you. There's just the conventional paradigm of medicine tends to just go one way, and that's great for an emergency care model where you have this acute emergency in front of you and you need to medicate or surgically alter the situation in order to save somebody's life. But what happens is, outside of that acute state, they apply that same model of care long term. There's no concept of convalescence or actual rehabilitation.
Manon Bolliger here, and I want to thank you for taking actionable steps towards engaging your healing journey and helping others discover their path by watching, sharing, subscribing, and reviewing these podcasts. Every review and share helps spread the word, these different perspectives and choices and options for healing. And to thank you, I'd like to invite you to sign up to my free 7-sequence email tips on health and healing for everyday life. You can go to healerscafe.com tips. Thanks so much. Yeah. No, it's I think that is the paradigm shift that I believe is happening. It's really coming back as people are getting a little bit disillusioned and, unclear about what they're being told at this stage, as the narrative kind of has shifted and changed, at least very recently. It's been very hard to follow. So I think a lot of people are going, well, how do we take care of ourselves? And I think we're in that time. And then I don't know if I don't follow astrology, but I hear we're in the age of Aquarius, and I hear that's all about,
maybe not so much with astrology, but certainly musical theater.
Exactly. That's how I came across it.
That's not actually true. I actually do have an astrologer that I consult with once a year, and I was such a skeptic about astrology until I met this particular person, and he kind of was like, well, let me just look at your chart. And he's like, well, this, that. And he told me some real specific things. And I was like, all right, I'm listening. What else you got? And I have a really nice relationship with him now. So I'm, there's something, I don't know what it is, but
Yeah, no, it's funny, probably a lot of people feel about us as naturopaths the same way as, but the idea is you have to open, try it, test it, see for yourself, give it a chance. Don't worry about what people think, and even if you don't understand it all, like astrology, I'm no expert in it, but I agree. I have had some insights that, it's they're hard to deny.
So when it comes to naturopathic medicine and kind of just, I think this is a common thing that you see, is that people who come, a lot of my patients anyway, are people who've already been through kind of a conventional process with their health. And so there is this level of like, I don't need to understand it because I just know that it's different from what I've been doing, and what I've been doing isn't working for me. But I think when we talk about this kind of reemergence of this type of culture, what comes with that is a need for practitioners of, integrative therapies, and whether that's naturopathic medicine or the spectrum, to be able to explain and talk about and have a grounded basis for what we're doing, that we need to be able to punch in the big leagues, even though I'm crossing sports metaphors. I'm not really a
It's
sports
okay.
guy.
I followed you.
But you know what I'm saying? Like we
do.
need to be able to, we know what we do works. We've seen it work, and we know that there is a scientific rationale behind what we're doing. Most of my therapies are based in straightforward anatomy, physiology, biophysics, of course, then nutrition and herbalism, which also is having a growing body of evidence behind it. Well, these things, we need to be able to talk about these things in a rational and easy way for people to understand, because what I'm seeing is more and more people are wanting a different approach as their first line of care, not their last line of care. And I think that they need to be comfortable and understand what they're getting at so that they can make informed decisions. Yeah.
Well, there was a survey done. I probably shouldn't even state it because I don't know I'm not sure the year it was done, but in BC that physicians were the primary physician of choice in BC. And the naturopaths were, which I thought,
oh, cool.
Which is kind of interesting. Now it could also be because there's I was on a list. It took over 4 years to find an MD, because I think it's important to have a team. So it's not just one naturopath or one whatever, physical therapist of sorts, or, and also naturopaths, they all tend to have special angles that's their thing, but they know everything else, just like an MD generalist kind of, but you wouldn't want to go to them for a sports injury. You would go somewhere else, right? So I very much believe in having a team, that is, but it took 4 years.
Yeah,
so
it's hard. I mean,
it's very interesting.
And this is kind of one of the major problems with healthcare in general, is that the onus is on the patient to piece together a team of professionals that they need. We don't have these truly integrated systems. It's kind of set up in this kind of hierarchical way, where it's like, okay, you go to your primary care MD, they refer you over to a specialist. If the specialist allows you to get PT, your insurance will cover it back, and and it goes. And there's that loop of, I read some tweet recently, and it was so accurate. It was like, you go to the doctor who sends you to the pharmacy for your prescription. The pharmacy calls the insurance company to get approval for that prescription. The insurance company calls the doctor to make sure that you need that prescription. It's like,
right.
Excuse me, like the doctor, anyway, it's like, who's the superfluous piece of this puzzle here? But I was going somewhere else with that, but the point being that I do think that, like, so in the work that I've done, I have quite an extensive experience dealing with oncology patients, and that is not ever one doctor's job.
Exactly.
That's always a team care effort. But I very much understand what my therapies do and how they are important in kind of a comprehensive approach to cancer therapy. And I work with oncologists, I work with their, with people in the rehab team, the whole deal. And you need to be able to kind of talk the right language so that the oncologist feels comfortable with what you're bringing to the table, and that you're not just throwing the kitchen sink at these people, that you have an actual rationale for your therapy. And it was hard. There are some usually younger oncologists who are newer in practice. They're more open. They've been exposed to kind of the concept that maybe it's not just chemo, and that's gonna be the only thing. And I'm not anti chemo. There's a lot of time where I my goal is to keep people strong enough that they can receive a little bit of chemo, and that can really get where they need to go. But the other side of that spectrum is the docs who are retiring, who are the oncologists who have seen a lot and have been around the block a few times, and they see the difference that patients who have come in with more of an integrative team on their heels, what that looks like. And that has made a difference. It's the docs in the middle that I've had to have some more toe-to-toe with. And again, you know, if you can feel confident, if you understand the rationale for what you're doing, and you're doing it from a grounded place, you're not doing it just because somebody told you that this was a good therapy, or I read this here, but you actually have you understand the rationale, and you can jive with that in the face of an oncologist who's calling you a quack. You know, that's opened up care teams to patients who would have maybe not had that
right. What would you say, like, because there's people listening that I mean, there's plenty of doctors listening, but there's also the public, you know, that is listening. What would you say in layman's term, like what hydrotherapy does if you have cancer? Like, can you explain it in a...
Well, here's the thing about hydrotherapy. I mean, let me just say what hydrotherapy has: a variety of actions on the body. There's so much that you can do with it. I don't think of it as a specific treatment for cancer. I don't use hydrotherapy to treat cancer. I use hydrotherapy in pretty much almost every case that comes into my office. I'm able to have a rational and judicious application of hydrotherapy, because basically it breaks down to this: water has a very unique property when it comes to substances we find in Earth, which is that it can store a tremendous amount of heat energy without losing its state. So you can heat water all the way up from 0 degrees centigrade to about 99.9 degrees centigrade, and it'll stay water. Whereas, you know, if you change that much heat energy in wood, it will combust into flame, etc. That gives water this ability to transfer a great deal of thermal energy. And so when you make a thermal application, either with a hot towel or an immersion in hot water, you're actually transferring a bunch of thermal energy into the body. Just the nature of heat, that's how heat will move. And that starts this whole process of a whole bunch of different biochemical and physiologic processes. It improves circulation, improves distribution of blood into the tissue, into the interstitial spaces. It improves the oxygen release from hemoglobin, so you get better oxygenation of tissues. And there's other things, you know, all sorts of kind of what are called cytokines, these kind of markers that kind of guide and direct inflammation. You can manipulate those with thermal applications. And the immune system actually activates and starts to become more active, and will increase its number of cells that you'll find. So all of those things will have a benefit on regulating the health of the body. Cancer is not like catching a cold. It's a process. And so, you know, everything that I do, so that's, and let me just finish to say, that's everything I do with hydrotherapy, with nutrients, with herbs, is to support the body in keeping itself well regulated. So cold water has a whole other host of things that you can utilize, and oftentimes I'm using a contrast of the two, which creates this strengthening of the systems of the body, you know, improving digestion, improving lymph circulation, improving distribution of that kind of metabolically active blood that I just described with the hot application. We can move that and distribute it into specific locations in the body, depending on how we use these hydrothermal and hydrotherapeutic techniques. So there's really just no end. I mean, it's simple in its application, right? It's the most basic thing. but to utilize it therapeutically, it's actually quite sophisticated, and there's so many ways that you can do it. So if you understand the pathology, and then you understand the need of the patient, because again, we're always treating the patient, we're always looking to see, where is this particular case, where is this person's systems and physiology deregulated, and how can we bring that back into a state of regulation? Cancer is oftentimes a combination of some sort of what we call an oncogenic event, something that has created an abnormality in the cell, and then the immune system's inability to recognize that and destroy it in a timely fashion, which happens all the time, every day in all of us. Yeah. But cancer as a disease is when the immune system was unable to do that for there's a variety of reasons why that's possible. So helping this body better regulate itself, you can help the body better kind of scan and attenuate to whatever conditions are present. But I want to be clear that I'm not saying you should forego any type of conventional cancer workup and just take a bath. Not at all. But hydrotherapy as a component of a comprehensive program of cancer care
makes sense.
Do it without it.
Yeah. I know I use that with my kids, to regulate a fever so that it was at the right level for the immune system to fight the best,
Absolutely.
And there's so many amazing uses of hydrotherapy.
I mean, fatigue management's a huge one. That's one that I think, like every if you were talking about kind of, if you're just a non-medical person listening in here, I mean, using hydrotherapy, just like you said, to either bring a temperature up to a state where the body can actually enact an immune response to rid itself of a virus, or maintain a temperature in a range where it's not at a danger to the body, but it still can do its job of, kicking out the agent that's causing the dysfunction in the first place. The fever is the body's healing response. Exactly. Physicians throughout time have recognized that, a well-managed fever can do more than any physician could ever do. So our goal is to help guide that fever into the right zone and let it do what it's doing. And we can discuss all the intricacies of what happens to the body during a fever and why chemically suppressing a fever with Tylenol or aspirin is a bad idea. But fundamentally, the body knows what it's doing, and we can help guide that into a really, a beautiful result. Yeah,
definitely. Yeah. So our time is literally up. Any last word that you would like to share?
Oh gosh, I feel like I've talked so much. I appreciate you bringing me on and getting to talk this talk. It's so nice to have a person to kind of chat with about this. I would say that fundamentally, we're at this time where we just really are trying to build out the next evolution of what healthcare is going to look like in North America and globally, and that the emergence of spaces like hot spring resorts, urban bathhouses, health retreats, health resorts, these are places where people are going to be actively able to go and spend a focused amount of time to go through a process of healing under properly trained guidance, with beneficial results and for their longevity and ultimately their the cost effectiveness for their overall treatment.
Yeah. Well, I certainly appreciated you sharing all this, and it gives me lots of hope, and I can start visualizing the possibility of this, because I've been wanting to go to one for so long, just to have real down time that is completely healthy and managed.
If you make it to Colorado, let me know. And then Murrieta Springs is going to be opening in November of 2023. And
there you go. I might put this on my list.
Yeah, come on down.
All right. Well, thank you very much, Marcus. It was lovely meeting you.
Pleasure.
Thank you.
Have a nice day.
Thank you for joining us at the Healers Café with Manon Bolliger. Continue your healing journey by visiting thehealerscafe.com and her website, and discover how to listen to your body and reboot for optimal health.